For today's video, I chose finasteride and magnesium sulfate. So finasteride is a 5-alpha reductase inhibitor. It's used for the treatment of benign prostatic hypertrophy. It also reduces the risk of prostatic cancer, and it can be used for the treatment of androgenic alopecia. It works by inhibiting 5-alpha reductase, which is an intracellular enzyme that converts testosterone to its metabolite, which is 5-alpha dihydrotestosterone, in liver, prostate, and skin. The metabolite is a potent androgen, particularly responsible for benign prostatic hyperplasia and hair loss. Some adverse reactions to be aware of for finasteride are reduced libido and ejaculate volume, reduced prostatic-specific androgen or PSA levels, and gynecomastia in clients who were assigned male at birth. So for a patient taking finasteride, we would want to obtain a baseline PSA level and monitor periodically. You would expect the PSA levels to decline with therapy, so any increase in PSA levels would need to be investigated further because it may indicate prostate cancer or non-adherence to therapy. You would expect the therapeutic effects to take 6 to 12 months and expect that this medication therapy to be lifelong. Expect the patient to have digital rectal examination of the prostate before and periodically during finasteride therapy. Be aware that the patient should have a urologic evaluation prior to starting finasteride therapy and periodically throughout therapy because the drug can increase the risk of prostate cancer, especially high-grade prostate cancer. Inform the patient that the drug may cause a variety of sexual dysfunction problems, including decreased libido, ejaculation disorder, erectile dysfunction, male infertility, and this may continue after the drug is discontinued. The drug is also known to cause fetal harm in the male fetus by preventing normal development of male genitalia. Patients and female partner of childbearing age should use an effective contraceptive during drug therapy. Be aware that females of childbearing age who may not know pregnancy status or pregnant females, like healthcare workers, should not handle broken finasteride tablets because of the potential adverse effects on male fetus. And then instruct family or caregivers to monitor patient for depression. If severe, notify prescriber because this drug can cause suicidal ideation. My next medication is magnesium sulfate, it's a mineral. It can be used to correct or prevent magnesium deficiency caused by alcoholism, magnesium depleting drugs, malnutrition, or restricted diet. It can also provide magnesium supplementation in TPN, or be used to prevent or treat seizure activity in clients with severe preeclampsia or eclampsia. Magnesium works to assist all enzymes involved in phosphate transfer reactions that use ATP, as magnesium is required for normal function of the ATP-dependent sodium-potassium pump in muscle membranes. Adverse effects to be aware of when using magnesium sulfate would be flushing, diaphoresis, drowsiness, muscle weakness, maternal hypotension, bradycardia, bradypnea, depressed or absent deep tendon reflexes, altered level of consciousness, decreased urine output, magnesium toxicity, or reduced variability of fetal heart rate. While giving this medication, we would want to monitor the infusion site, check client for adverse effects, check the client before and throughout therapy for headache, dizziness, blurred vision, and muscle weakness. We'll monitor blood pressure, pulse, respiratory rate every 15 to 30 minutes and report any respiratory rate of 12 per minute or less. Monitor deep tendon reflexes every 1 to 4 hours. We'll discontinue the infusion and notify the provider of diminished or absent reflexes. We'll monitor level of consciousness before initiation of medication and throughout therapy. Monitor strict input and output with urinary output hourly. Report urine output of less than 25 to 30 ml per hour. Output less than 25 ml per hour can warrant discontinuation of treatment. We'll also monitor the serum magnesium levels, ensure the antidote for toxicity, which is calcium gluconate or calcium chloride, is readily available. We'll monitor breath sounds, report presence of crackles, and discontinue infusion and notify provider of findings if we do hear crackles, and then monitor fetal heart rate for decreased variability.